Good everybody. Today's February or November, not February. November 22nd.
Saturday. First 2000.
I have my phone on silent too, I promise.
Thank you, Siri, for reminding me. Long story short, we called meeting to order. Can we get approval of the October regular board meeting minutes?
I'll move approval, Mr. Chair.
Got a motion and a second. Any
Further discussion?
further discussion? Nothing? Okay. All right. Got a motion and a second. All in favor, say aye.
Aye.
Any nays? We got all ayes. All right, thank you. Public comment. Anybody here? No?
Sorry, I just disabled the waiting room, but there's BFHD staff is all. Okay. If you would like to make a public comment, please raise your hand in the Zoom app, or if you are on your phone, you can press *9 to raise your hand now.
And we're not seeing anyone. Yeah, okay, so we'll close public comment. Senior staff comments, nothing. Wow, we are moving.
Holy cow.
Additional, okay, so we're on. Okay, good. We'll do unfinished business, on-site sewage rule updates.
Already?
Hey, While Jody gets set up, I wanted to kind of introduce this section. I know that we had a presentation last month. It feels like it was 3 months ago, so maybe a number of ones I hit on this. And going forward, we did take some of your feedback from last time and make a few tweaks to the draft. But I also wanted just to kind of remind that we did have an industry committee that we set up throughout the summer to talk about this whole rule change. That committee had on-site sewage engineers, we had land developers, we had installers, we had a mix of different industry, representatives on that committee. Everything that Jody's bringing to you in these meetings has already been unanimously supported by that committee. So that's one thing I wanted to baseline us in. And this rule is one of the few local ordinances that if we are going to pass, the State Department of Health requires that they review our rule as well. So currently Jody is working with the on-site sewage engineers at Department of Health to review the draft for technical language. So part of why I'm going over this is that I want to make sure that you know that we're not trying to ask you to be technical experts with the rule. Certainly, if you find anything particularly problematic or have questions on it, let us know. But I wanted to make sure you didn't feel like you need to be able to parse through each and every section of this. So we're going to try to go a little bit more broad this time, and then feel free to follow up afterwards if you have questions.
It's just a little question. So I know that on some of these rules and stuff like that. So the reason why the state's looking at it, because typically they want to see if we're meeting, at least meeting their expectations. Yes. But if we're superseding them, they want to.
Correct. Yeah, that we are not loosening the minimum standard. Yeah, that and this one in particular is such a huge rule. It's large and it's very technical. I think they just want to make sure we're not, presenting anything in it that's gonna not be legal. Yeah, exactly. Okay. So they're going through it piece by piece with us as well.
Okay.
You need the podium way over there.
Okay, so I am talking today about the changes to the lot sizing. And that's pretty much the only issue I have today. What I gave you guys with last week was mostly the stuff that we wanted to make changes. But this one, we have a minimum land requirement. If you want to go that we have to meet. And the purpose of that is to make sure that there's enough space on each new lot that's created to install a on-site sewage disposal system and have room to support a reserve system for the time when the initial fails. And we also, because of nitrates, have to address that there's enough space to accommodate nutrient loading from that OSS to not impact the surface water or groundwater, because once that plat goes through, the lot is presumed to be buildable. There may be issues with where the property owner wants to put things, like if they want to put their house at the top and have a great view, that might not be it might not work because that's the only place where the septic system can go. So those things are addressed case by case, but in general, a lot is presumed to be buildable. So there were two sections of changes. The first one is the gross land area. And that includes all the land area, including the easements, setback, there's no setbacks. Yeah. We are not proposing to make any changes to this, except that the state has changed the lot sizing for an individual lot when they have a well on it. And if the soil is type 5, which is a silt loam, really fine soil, and that soil takes a large rig field. So they did change that sizing from 1 acre minimum lot size to 2 acres minimum lot size. And that's a state change that we're just going along with. We're not making any of the other changes with that. The one that we are making changes to is the usable land area. This is places on the lot where the septic system can go. So if there's a setback from the property line, which is 5 feet, you can't put your septic system there. Your usable land area just got decreased by 5 feet all the way around the lot. If you have a well already on the lot, there's a 100-foot circle around that well that is not considered part of the usable land area of that lot. Currently, do you want to go to the next slide? Okay, so currently on this table, the first line shows what our minimum usable land areas are. So depending on soil type, it's all the way from 1/2 acre down to 12,500 square feet. So we are proposing to half those because they are kind of excessive for it. I worked it all out. So like a 4-bedroom house could go on one of these lots and they could have up to 4 places to put that septic system. So I am proposing that we half it, which will give developers a lot more flexibility on where they can put their septic systems and even to create some new lots, because I have some lots up in Prosser that are waiting for this rule to go through because they only have 3 feet of soil. And one of the things we are also coming into alignment with the state is we are changing our vertical separation from 3 feet to 4 feet to 3 feet. So this also opens up a lot more places where the septic system can go.
Will that make it easier for more usable, or more housing? To build more housing out in the rural areas, or not so much?
Not so much from more housing because there is a minimum lot size.
Yeah, that's what I was thinking, okay.
And even though the state raised it to 2 acres for type 5, if they're out in Benton County, for example, they have a 5-acre minimum.
Yep.
So it doesn't even.
I just wanted to make sure, because in case anybody is watching, so they understand that. So,
Right.
everything's simple.
What would possibly allow for more housing would be with relation to the nitrate issues. Go to the next slide. So the state created some nitrate-based methodology on how to deal with the nitrates that are created by the septic system and how to dispose of them and how much, what the load is per lot. And they got very creative with it. They have not even finished with their guidance document for this yet, so I can't talk too much about it other than we felt that we would address them when they came up through implementing a new fee code for if there was a developer who wanted to have smaller lot sizes because they were going to go use nitrogen reducing technology. We would address that on a case-by-case basis at our hourly rate. And if there was a homeowner who wanted to reduce his drain field size by using the nitrogen technology, we would also have him apply for that opportunity. And then he could do that without a waiver, which would make things a lot easier in the end. And those are the changes to the lot sizes. So.
I'll add too, I think, some context to the question about the lot sizes. the initial part that she presented, while it wouldn't necessarily reduce that lot size, it allows a lot more flexibility with what you could do with your property. Your shop, your pool, so that usable land area would be cut in half, so you have a lot more space to develop on your individual property,
Oh,
so.
that's super important. I agree with you, because a lot of people want to put a shop on some of that impedes it once in a while, so that gives a little more flexibility.
Yeah, and then the 4 foot, the vertical separation she talked about, so currently they require 4 feet of vertical separation of usable soil, whereas we have, some areas in our outskirts like Prosser, Benton City that have really rocky soil, went down to 3 feet. So you only need 3 feet now. And so again, both of those are changes that make building development a lot more flexible.
And it will also allow for more conventional gravity flow systems. Because right now, if they have 4 feet of vertical separation, they would have to put in an engineer design system. But if we go to 3 feet, they can go back to conventional gravity. So that helps with a lot of the costs with that, so.
Yeah, I just wanted to say, I think this is great. We're keeping pace with the technology, if there are nitrogen reducing technologies out there, why, we should be keeping pace with that. And I'm glad to see that we're taking the initiative on helping developers find more flexibility within their, their development spaces. So I think it's great. Thank you.
Thank you.
Thank you. All right, Amanda. Oh,
not
sorry.
being asked,
I'm sorry. Officer Health Officer update.
Dr. Kreger, I thought.
Dr. Krager on?
I know. I think he's got Chick-fil-A on the brain.
You're all hungry? Is that what's happening?
I just.
Well, let's see, we're gonna try to, where are you, where am I? Dr. Kreger and I are going to give a joint, report. Get that out of the way. Thought it would be a good time to just update you all on the, avian influenza outbreak that we've been working on. Kind of give you the 35,000 foot level of what we did, how it went, where we're at right now. And so Dr. Kreger and I kind of split the slide set up. I'll take the first couple of slides and then he can finish up from his perspective. Next slide.
And so you don't have printouts in there, but I do have the ones that printed out in case you need it a little bigger.
So the timeline, just wanted to give all of you a brief overview of kind of how this happened, and a reminder that this was also the same facility that we had in December of 2022. So we were familiar with the facility and the leadership out there. On the evening of October 13, I got a text message from the state veterinarian that on Friday, the 11th, the veterinarian out at the facility had noticed an unusual amount of birds dying, and that always alerts them to finding out why. So testing was done at the Waddle Lab in Pullman, and they did test positive for avian influenza. And then they were going to be waiting to get the specific strain determined at some point in time. So on the 14th, we stood up at a very low level response team in-house, because typically when we're notified of these types of situations, we understand that Washington State Department of Ag is really the leader out there. They're the ones that are involved with the decisions on the birds, the depopulation, the cleanup, and all of that. We take a rather secondary seat at the table, and our focus is really on the human side of any operation like this. So in 2022, we didn't see bird to human transmission concerns, and that changed in this go around, and definitely changed how we ended up responding. So on the 14th, we did reach out to the company so that we could open up our lines of communication a little bit. And at their request, we did go out and deliver some personal protective equipment so that the employees had access to what they felt they needed out there. And we asked, please let us know if you start noticing any symptoms within your employee work group. Very quiet until Friday, the 18th. And luckily, we were all at a workshop for special pathogens anyways. DOH was there, the players were there. And as we were attending this, and I was getting the text from the company saying, Heather, can you help us? We have symptomatic employees. We need vaccine testing and Tamiflu. So we slowly started exiting this workshop at track and ended up gathered out at our tables in the hallway, Erin and the rest of us, to put our plan together. And that meant reaching out, of course, to Department of Health. Luckily, we had Department of Health partners within our meeting as well. One of the things that we find is really important to do at the beginning of these types of events is set up not only our infrastructure, how we're going to work the event, but also time coding so that we can capture how much time staff were involved in these various incidents. So all of that was in place, and we were gathering and setting up our team, and their request was to come out actually that day to do influenza testing, vaccination, and offer Tamiflu. Luckily, we had a stash of Tamiflu in-house that we've had since 2022 when there was a Tamiflu shortage, and we were offered a stash, and so we had that in place, thank goodness. We only had 5 vials, transport media vials, and they're at that time, we estimated maybe 50 to 100 employees. And so we started scrambling, where do we find more viral transport media? Reached out to Department of Health. They did begin a shipment of some vials, but it really wasn't going to be enough for this operation. So we had to reach out to our partners, and lucked out, and Our Lady of Lourdes was able to come up with what we needed for that day. So within a matter literally of hours, our clinic team had gathered all the equipment they needed and went out to the site and began testing and offering vaccine and Tamiflu. We developed our teams because we decided we needed to activate
I'll tell you how wonderful it is.
in our ICS structure. We developed our clinic team, our infection prevention team, our data care and coordination team, and our contact tracing team. So that was the 18th. And literally to get these samples tested, that meant that we had to drive them to the state lab over in Shoreline. And so Franklin County Emergency Management, Sean Davis, actually drove our samples that afternoon, deposited them at DOH lab about 9 or 10 that night, so that they could immediately start testing the next morning. And that day we did get our preliminary test results as positive. And what's important to understand is they do a preliminary test at DOH lab, then they do a confirmatory test, and any of those tests then get sent back to Center for Disease Control to get the final confirmation. So it's really not confirmed until CDC confirms it. The next few weeks were really busy. Staff worked all weekend into the evenings. Some of our concerns certainly were the neighborhood out there. Luckily, they're not out on their own out there, but we also know that dairies are nearby. Within 5 miles, there are some dairy operations, and we didn't know exactly what strain this was at that time, but we did later on find out that it wasn't the strain that was infecting dairies. So that was helpful to know. We initiated symptom monitoring. What we also realized is 2 employees had actually been taken to one of our local emergency rooms for conjunctival symptoms and had some testing there. They actually didn't do any testing there. They just saw them and sent them on their way. So not only did we need to initiate the surveillance for symptoms on site, but now we had potential hospital employees exposed to these workers that had come into their emergency room. We, like I said, started the symptom monitoring both by telephone and some electric a surveillance system we're able to do, working with DOH to get that set up. They offered to have some staff from Center for Disease Control come out. So we had 3 staff members from CDC fly out and work with us side by side to help us with our data and some of our technical assistance we needed. They were here for what, about 5-6 days? And then they moved on to the next outbreak. So some of the things that were ongoing again is ongoing testing happened. One of our concerns when you go into a facility like this and you're testing people at the end of the shift, are you getting environmental contamination when you're swabbing their eyes and their nose, or is it truly infection? And we had Dr. Megan, I always call her Dr. Megan Guffey, her last name Guffey. She is our regional medical officer for this side of the state. She actually went out at that first testing site, and she was concerned because there were some pretty significant conjunctival symptoms that led her to believe it was probably more than just minor irritation. So we did testing, and we did get some positive results out of that test, but we needed to consider the potential environmental contamination. However, if you're working in a facility like that and you have your correct PPE on, you should still not be getting conjunctival swabs positive. So we knew that there was probably, not only from that, but from having conversations with the employees, that there was a breakdown in PPE use. So we were really focused on making sure they had adequate PPE, the correct PPE. We had a group of staff members that went out literally at 4 a.m. to teach the employees how to don and doff PPE correctly. And then we conducted a second testing event. Again, 4 a.m. The whole team went out because we wanted to do the testing at the very beginning of the day before people went on shift and had that potential contamination. As we were working with the employees out there and those that were symptomatic or potentially needed to go into quarantine, our care coordination team was working with them to make sure they had access to food and the things that they would need, because they couldn't go to work. They weren't supposed to go to the store while they were being isolated. So our care team worked with them. We knew there was significant concern with PPE use. And at one point, Labor and Industries did come on site and work with them as well to ensure that staff were being taken care of with that regard, because it was obvious there were some definite lapses in PPE use. We also, on a Sunday, met with the local people, staff out there, the contractors, and then the parent corporation back in Iowa. We had a call along with a senator, a representative, a commissioner, and just had a conversation about the operation out there. And the parent company was really responsive and did send out it was their COO came out and met with us as well. And so it was a fast and furious 3 to 4 weeks. Staff did an amazing job of all the work that they did. So I am going to turn it next to Dr. Kreger, so he can go over the data we collected, because public health always collects.
So I do have a quick question though before you do that. So I can't remember at the very beginning, and I apologize. You said as far as transfer from bird to human, this was the first case here.
Yeah.
How about as far as the US?
I mean, we've been watching it in the dairy industry transfer from cattle to humans.
Yeah.
So this was the first time we had a bird to human in Washington state.
Yeah.
And the other concern is looking at the strain and realizing it was a new strain from wild birds entering the poultry population. So knowing you are a hunter, and this is waterfowl season, and we know this is where avian influenza comes from. that's also something we want to caution is when you're out waterfowl
Outfield, yeah.
hunting, you need to be cautious as well. And maybe Dr. Kreger will talk more about this, but the case in Canada in the teenager is the same strain.
Okay.
And that teenager is in critical condition. So we know that flu viruses can go ugly.
Yeah.
And that teenager they have not reported anything of concern as far as underlying conditions. They said he had no underlying conditions that would cause him or her, I don't know what it is, more likely to have a bad outcome. So, this is a strain we're certainly keeping an eye on.
Yeah, that totally makes sense, especially as we're starting to come in more to the height of waterfowl season for a lot of different.
Yeah,
things.
yeah, and I know they're swabbing out there. My husband was out there.
Oh, is he? Okay.
Fish and Game does
Sorry
do
to do that.
swabbing and keeps an eye on what strains are coming.
Makes sense.
I'd like to add to that, this is right next to my house.
Right, yeah,
That's a natural flyway for the birds.
yeah,
Nobody has to be out hunting. It could be they're flying right over and they're dropping their drop leaf
Yeah.
on the parking lot that they pack in with their shoe. It could have been that simple, so.
Well, I asked the COO when he met with us, being in public health, I like to see if we can prevent things like this. And I said, what are your thoughts on prevention? And he said early outbreaks, because they have facilities all over the US. He said it was definitely poor biosecurity of staff going in and out of buildings. But since their company has really tightened the biosecurity, they're not seeing that happening. And so they look at where the attack happened in the building, and it's happening internally, so they know it wasn't brought in. And so they're looking more at the ventilation systems in these facilities. And so they're working with, I think it's University of Iowa or Iowa State, where the parent company is, to try to come up with ways to sanitize the airflow and stop these things. Yeah, a bird flies over and and that's, how people can contaminate their backyard flocks. So no, my husband does not clean birds next to my chickens.
Commissioner Alvarez, the language we were working with CDC indicated it was the 5th case of human-to-human transfer in 2024 when in the United States,
Wow.
in the US.
Yeah, that makes sense. So it's really, we gotta really watch that.
All right, Dr. Kroger, I'll let you take it.
Thank you. And just to clarify, Dave, I may have missed part of this, but there's been human cases from like an animal. There's been 55 cases so far in the US confirmed this year. So we make up about 20. We have 11 confirmed, although 14. Anyway, I'll get more into the data. So yeah, we had a pretty significant chunk of those so far this year. Unfortunately, well, what happened? Now I can't see our slides.
Hold on, one sec. Technical
Okay.
difficulties.
That's okay. That's okay. So I'm gonna go over data, and yeah, thanks to Heather for giving that background. I do also, just while we're waiting, like really wanna, I've probably done this on a lot of meetings, so I apologize if I'm repeating myself, but really want to give kudos to all the staff. More than kudos, just oh man, it's hard to express just how hard they worked on this response. The long hours, lots of stress. It was very kind of confusing and difficult at first, I will say. We had a lot of coordination, a lot of meetings happening, a lot of people asking for things. Sometimes we didn't have the answer, and I will say part of that is because this is a very kind of new phenomenon. I mean, we've known about, avian influenza for a long time, but things are changing rapidly. And unfortunately, we're kind of at the forefront of that right now. So one other caveat I want to give with this data, we're still kind of cleaning up some of this data we had, just to give an idea of some of the challenges. Like we'd, talk to people and then we'd get a form, and sometimes they'd write down one name, and then sometimes they'd write down a slightly different form of that same name. So making sure we have accurate numbers is actually very, very challenging in a lot of ways. So this may change from when we're finally done kind of analyzing all our data. But we think about 253 people, maybe up to 270, but there was some deduplication that happened. Potentially exposed. So these are, facility workers and then a lot of contractors that were brought in, like Heather talked about. 55 of those that we were aware of reported symptoms, and this was kind of a mixture of red eyes was the most common, so that's conjunctivitis, and then kind of pretty mild for the most part upper respiratory symptoms, some cough, runny nose, sore throat, that sort of thing. Not a lot. Some people had kind of like subjective fever, and just feeling, achy and not great. But most were fairly mild. We ended up swabbing 74 people, so mostly symptomatic people, but we did swab a few asymptomatic people as well. And then 14 of those, we got a positive test at the Washington, so WAPHL is Washington State Public Health Lab. And then as Heather mentioned, that gets forwarded onto the CDC, and 11 of those were confirmed. I will say, and this is how we treated them, if we got a positive test result from public health lab, we treated them as a case. And there's just there's a lot of thought that the sample may have degraded over time as it was shipped and frozen. Anyway, I think those 14 or all 14 were probably true cases. We talk about an attack rate, so out of so many people potentially exposed, how many actually got infected? That was about 4% if we get to 11, slightly higher if we say 14. So no severe illness or hospitalization, which is great. As Heather mentioned, we do know this can cause severe illness, but that's one of the frontier questions we're trying to answer is why does it cause this mild illness in some people and very severe critical illness in others? We don't have a great answer. Lots of theories, but no really good answer to that right now. Lots of staff working on this. It took a lot of effort, as I mentioned, and unfortunately a lot of money, just in terms of time. So, and that I bet that number will go up too over time when we're just talking about the cost of our response. Okay, let's go to the next slide. Lots, and this is also something that will change. We're still learning, but I mean, in any sort of complicated response, there's lots of challenges, obviously, and lessons. Heather mentioned initially we felt a little bit out of the loop, and then obviously got very quickly involved once we learned about how many people had symptoms. But I think one thing we learned is if there's a way to get involved even sooner, that would be ideal. That's some feedback we provided to the state and our agricultural partners. Heather also mentioned this this is again something we're trying to determine, what actually is causing these symptoms in people. Is it a combination of lots being exposed to a bunch of dander and dust from cleaning up these animals, and not great personal protective use, or is it true infection? Yeah, I think in most cases, my gut is that it's a true infection, but I'm not 100% confident in that. We'll see. One of the biggest challenges was just, this facility hired contractors, and that just put an extra layer, right? So we were trying to communicate with the facility, and then we'd get contact information from the contractors, and sometimes there was just challenges, right? Getting lists of employees, lists of people working, stuff like that. Let's see, man, I mean the amount of coordination, especially initially, was kind of mind-boggling, just trying to understand what everyone was doing, everyone's roles, and how we could I guess best keep people safe. It was just a complicated response. So one of the things that we learned even more about, and I'm still learning about, is what it exactly looks like to take care of 800,000 unfortunately dead birds. It's a huge logistical undertaking, right? And from our standpoint, how exactly that gets done is less important as opposed to what that means in regards to human health, right? So when workers are doing this work, when are they actually exposed to virus? When, what type of work is potentially more dangerous than others, that sort of thing. And then this thing I'm kind of excited about in a weird way. It's hard to be like excited about, a really difficult thing, but I'm excited about the ability of our response and the data that we've gathered to help other people, right? To help other health jurisdictions, departments across the state. I mean, we've already had a ton of conversations, I will say. People have continued to kind of reach out to us about asking us questions about how things went. If a small situation of their own pops up, kind of how to respond. You may have seen on the news, King County had unfortunately one of their geese in the zoo died, two of their geese actually. And so I was talking with the health officer there, and obviously that's a very different situation, a zoo compared to an egg farm. But again, our experience I think has already helped kind of other jurisdictions respond. So, and I'm really curious about some of the kind of ongoing data collection, kind of trying to figure out, what represents true infection or not. I think we'll have some useful things to share with the kind of greater public health community, which I think is neat. Let's go to the next slide. That's it. So yeah, I want to re-emphasize, I keep saying this, but the staff responding to this just did an incredible job. I got to be there for the first part in person, which was great to be there and just honestly, we had some good bonding over a very difficult situation. So that's my perspective. I think we'll probably share more as we kind of learn, or wrap up some of our conclusions. We'll be able to share some more too.
Any questions?
When's the price of eggs going up again?
Well, so that's, I was gonna mention that. I heard on the radio today that nationwide, with this issue across the country, egg prices are gonna be going up and stuff. And then I even heard it's happening in Canada too now and stuff. So it's getting pretty serious. So hopefully, yeah, with us doing what we're doing here in Benton County and getting things figured out, we can protect it, and hopefully the whole country figures it out to make it to where the prices go back down.
Well, I think it's important for the public to know, I mean, that these things do cause inflation, when you have fewer eggs to sell, but it's gonna increase the price of the eggs in the store, so.
A little bit about the cleanup on this is the first bout. They were talking about bringing in dumpsters with bags, thing and taking it to the dump. They ended up composting the birds.
Oh,
that's the best way to do it, because everything, it just disintegrates. So they compost. I'm pretty sure that's what they're gonna do this time.
That's what they did, yeah,
They're gonna do it right on their own property. And it actually makes really good fertilizer.
Yeah, it's too
It's
bad.
another reason for bringing contractors in.
Well, it's just too bad that egg prices are going up, because I love my over easy egg.
Hear the price of eggs,
Yeah.
get some chickens and get them in your backyard.
Heather and I have chickens.
Yeah.
Behave yourself.
Yeah. All right, moving on. Name stuff survey.
Yes, and I'm also passing this.
Okie dokie, I'll try to make this short and sweet. I'm even gonna time myself because I'm also trying to figure out what's a good sweet spot. So really quick update, what I'm sending you right now, or just passing it along, is our Stay Warm temporary warming centers. Just as an update, it is back this year. Started it in 2022, and we're just expanding even more. Thank you to all of the cities as well as the 2 counties. We've been in close contact with all the PIOs to better understand a center, which is just an opportunity for during business hours to stay open, so that anyone that needs some warmth, Heather was telling me earlier, you can hit hypothermia even in the 40s and you're wet walking in, and getting some relief from that will be a great opportunity for our residents. When it comes to shelters, that's a city thing. So our PIOs have really jumped in and stepped up. And so we're excited to see how we can move forward and help share their information on overnight shelters when it starts to get really, really cold. So it looks like it's warming up, but again, it's going to drop back down before So that's a quick update for you guys, and again, a shout out to all our PIs. They've been wonderful. Now, when it comes to survey, I know I talked to you all about a branding survey that is still in the works to get the community feedback on the name change. So just to let you know, we're still working on that. In the meantime, our goal is to try to find a way for staff to be able to continue to communicate with the Board of Health and figure out exactly what y'all are looking for from our staff, what questions you have, what feedback. This is more of an opportunity for us to kind of create that relationship between staff and the projects and all of the great work that we're doing here at the Health District and all of you. And so we wanted to do one of those surveys where it was completely unattached from Benton-Franklin Health District. So people felt comfortable and safe to kind of, address, not so much address specific questions. It was just more about involvement. So I have a couple ideas for kind of questions to start the flow, and then if you guys.
Can I ask, just add one more thing, just so you guys know, this is actually tied to our strategic plan. For this last 18 months, this is part of our building trust between staff and leadership in the board, and then the board and staff. So we hope to bring this back every year. It's just an annual thing that we do. So that was, sorry, just a little plug there.
No, I'm glad you said that, because I just went right down into the weeds. So thank you for helping me come up for air. So looking at kind of engagement and involvement, what areas of your work do you think the Board of Health could be more involved in? Some of the questions, are there resources or tools or other support you feel the board could help provide to make your work more effective? We're talking about like relationships within the community. How can the Board of Health be more involved in community outreach or events to support your work? Any opportunities you feel like the board could help strengthen connections between the district and the community, making connections with us, with other people that maybe might be helpful. I know our commissioners do that, but our non-elects can do it just the same. If there's opportunities or things you see out there that we need to be aware of, or that our staff can like you to help and support us in certain ways. So I just wanted to kind of throw that out to you openly, see if there's anything that starts to percolate, and then I can follow back up with more of a legit list.
Personally, for me, I'll start off. I think you guys are doing a great job. So I just keep doing what you're doing. I don't see any changes that need to be done with what you guys aren't doing. You know what I mean?
Yeah, I think Amanda just read off a couple of questions that we could ask staff, or you guys could all ask staff that we can help facilitate. So if you want, we can have her bring back that list as a draft. But if you guys had ideas, she could start putting that into the draft of what would you want to ask staff about how you could help with trust. Yes, we're doing our part as leadership, but what can the board do?
I think also just once in a while, maybe having a different department head come up here, because there's so many different things going on in the health district here. And I know I did a quick tour one time. It was pretty overwhelming that first day because I was also counting square footage.
Yeah.
You guys all got that, right? But getting some of the departments to come here and giving us a presentation of what they do, their challenges, what we can do to better help them, to support them out in the community too. I think those are always good things to do, as well as the financial side, so we can make sure we make good educated decisions, because everybody's having challenges with all the different departments, all the cities, all the counties. That would be another good supporting type thing, another topic too. But I think having department heads coming up here and giving us more information on what they do and how we can help them support them. That would be a good one, because there's a lot of different things going on, and you guys do it. You guys, and I talk, entire staff does an amazing job. And the other thing too is letting us know, just like this circumstance here with avian flu, it's letting us know the things that are going on health wise. So when I'm pretty exposed out there. I can't go anywhere, grocery store, someone going, hey, you got a second? And that way, if they ask me anything about this, if I'm on this board, I can talk intelligently and tell them what you guys are all doing to help support that and being more proactive. So just things like that.
Yeah, I know that's kind of some of the conversation we're trying to have, especially with other elected leaders, is kind of, the 5 top things every month. I know I sent you all an email out when it came to the lead. And so things like that are just starting to kind of pop up and percolate, that might be an opportunity to keep y'all obviously informed, but also trying to figure out if staff can make a better connection with you all if it's coming here for the board meeting in bite-sizable pieces.
Yep.
Yeah, I have.
I'm just a
really
simple-minded guy, so that's good.
I love it, I love it.
And I've appreciated the level of communication as well. Every time I get one of those notices, I really appreciate it.
Yeah.
I've never been on a board that's had that level of communication, and it's just really comforting, I think, to know.
This can also be communications time to help facilitate from staff members what they want to hear so that we're never in any means gatekeeping, but it gives us a chance to go, okay, well, we really do need to make sure we need to be sharing more about this. So if there's staff that are out there that are interested in sharing that maybe we didn't think about right away, that would be a great connection for you all. So I appreciate that feedback. Awesome.
Thank
All
you,
right,
ma'am.
thank you. Well, that was almost 7 minutes. So, okay, not too bad. I'm trying to get it down to 5.
On your stay warm,
Yes.
you ought to get a hold of Benton-Franklin Transit, because everybody's riding for free anymore, and they can get on a bus and get warmed up too.
Yeah, actually, I'm in contact. I talked to our marketing.
Well, they're warm. If they're
Yeah.
warmed up, get a hold
We
of Benton-Franklin
are
Transit.
putting a new flyer out coming soon. We're working with BFT to put all the transit routes. And so we're gonna find different ways on how we can utilize those partnerships. So any ideas like that, great.
Thank you. Mr. Kyle.
Gotta stay out of trouble.
I'm gonna start.
I like being
It's you guys. We'll give you,
Oh, you're gonna move up?
We'll give you 35 seconds.
You would love that.
I have one disclaimer for this discussion. Everybody can participate in the discussion, but in terms of fee increases, so that you know, only that can happen by our elected officials. So just as a heads up, but everybody can listen in and participate in the discussion.
We don't have a quorum to make a decision on that, do we?
We do.
We do.
Oh, that's right. There's only 4 commissioners. now.
Yeah.
Yeah.
And make the right decision.
With discussion, I think we might.
Hey, my name's Eric Elsleg and I'm the senior manager for business systems. I'm over the IT facilities, billing departments
And finance.
and finance. So this is my first time speaking to the board, so be gentle. I did get a haircut recently, so I think I'm ready. So I'm gonna give a quick overview. I'm gonna talk about fee adjustments, what's the purpose of them, and I'm also gonna give a little spiel about attrition. Attrition kind of dovetail into fees, because fees in an indirect way support staff salaries, operation costs, et cetera, et cetera. So once I get down to my intro, then Kyle will get up, he'll talk to you, and then Jody and Luke will get up and talk about their 2 departments respectively.
And you do have a handout of these slides in your folder.
So the first thing that's important is I think when we talk about fees, we need to make sure that we're coming from the same understanding of what we're talking about, what fees do. So what do fees support? Well, so like I said a second ago, fees support the operational cost of BFHD. That includes staff salaries and benefits, supplies and materials, and utilities. Fees also supports maintenance upgrades, whether that's equipment maintenance or hardware and software upgrades. Also staff development and training, if certain employees need certifications or et cetera for their job, fees can go to support, and also inflationary adjustments. So as we know, inflation's gone up quite a bit over the past few years. That's going to have an increase in materials, which I believe will go into one of our arguments for our fee adjustments this year with our other departments. Okay, next slide. Okay, so a little while ago, not related to this meeting, Janae asked me to do research on how attrition of our staff is affecting some of the hidden costs associated with that. Because when a staff member leaves, there are going to be some hidden costs that may not be captured just on a ledger. So I looked at the food safety and land use departments. Now I didn't do lab, but lab uses the same job classification for their staff as food safety and land use. It's an EHS1, so it's environmental health specialist. All 3 departments use the same job classification.
I gotta ask you one question. I apologize. When you're talking attrition, is attrition because people are just leaving, or is attrition because you did some type of a freeze, you know,
It's just turnover in those departments.
okay, because I wanted to make sure on that.
Yes,
Because
not
you can go
freeze.
ahead and do a you know, a job for, you know, a department freeze of hiring, so I wanted to make sure, okay.
Nothing to do with that. It's just essentially the turnover in those departments,
Okay.
the natural turnover.
Okay.
Okay. Okay, and so before I go, so working on this report, I just want to make sure everyone understood the methodology I used to come up with the numbers. So if you had any questions, you would understand how I got to the results that I got to. So as far as methodology, the first thing was the data collection. The data was collected from our HR systems and our time coding systems that are in-house at BFHD. The sample selection was BFHD staff in those two departments from 2014 to 2023. And then looking at that 10-year period, we then looked at the staffing that charged the appropriate programs that would either be food safety or land use. Food safety is essentially got one that we're looking at, land use has multiple codes that we're looking at. Then once we got to that number, that subset of the employee staff, I then went to the managers and said, confirm that these people were inspectors, that these weren't a one-offs, that someone for some reason 8 years ago charged to a program for food safety and land use, but it was really not an inspector. So that then narrowed down my list of staff and looking at it even further. Then I went into our HR system and I looked at, for all those staff that I looked at my list, I went at their job position, because staff can have multiple positions at BFHD, right? As we float around from department to department through transfers, et cetera. And so for the job classifications that I'm looking at, I then got their start and end dates for those jobs. So now I've got a staff member that was in either food and safety and when they started that position and when they exited that position, if they have. For the cost of salary, so for the hidden costs, what am I looking at to say, these are the monies that, for a better term, have kind of gone out the window because we have turnover. And so the staff salary was the first thing I looked at. And the reason I looked at that is because when someone is a new hire into one of these two departments, they cannot do an inspection on their own for 6 months. So essentially you're paying for another FTE, but they're not providing any additional services. They've got to shadow and learn for that 6 months until they can. And then after that 6 months, then they can start doing inspections. And as far as the cost of attrition, then they would be removed from my report because now they're a fully trained staff doing the inspections that are required for either land or food in this example.
So you haven't done a hiring freeze. I understand. So I'm not hiring freeze.
Nothing with a hiring freeze.
Natural attrition, I understand that.
Natural attrition.
So are they being hired away? What's causing that attrition? Because I know there's also a cost of, you know, is it wage and compensation?
That seems to be by far the biggest competitor for us.
So have you guys done a wage and compensation study or anything like that? And how often, how long ago,
I think that's something that's being worked on by HR.
So my plan is to have it officially documented every 2 years, but unofficially this year I've already started it and I'd like to keep an eye on it annually.
Yep.
Within public sector across the state, I have that information. When you start looking public versus private, that's a little bit different data because of Amber. And healthcare has another skew on that as well. So we do have some of that data and a lot of it is driving because of the wages.
Yeah, I think that would be, especially if you're looking at wages and stuff like that, and because there's a cost benefit. If you have natural attrition because of that, there's a cost of just retraining, like you said, there's not providing any value until XYZ amount of time. So that's why I want to know if we're going to talk about some type of financial decision down the road here. I want to make sure I understand it. That's what I'm asking.
It's a seed I'm hoping to plant.
I get you. I'm reading you.
I'll add too that Hanford is our main draw for our environmental staff because you can do a like job out there and start at double the salary. We'll never be able to compete up to that level. But that's why Eric's highlighting some of these other hidden costs with this turnover as well.
I talked to some of the CEOs over there and CFOs and say, stop doing that. I'm teasing.
Please, if you will.
I'll have this discussion after we're done with this meeting.
Oh, that'll go there, man.
You just hired our guy.
Not on purpose.
Now, for the next part, you're not gonna need your full seat, you'll probably just need the edge.
Okay.
It's really exciting. So another factor for lost, not the hidden costs would be supervisor support. So when talking to the land use and to the food safety managers, they said, when I get a new staff member, it may be 10% of my time in a month or more that I am helping to train this individual with all new staff. So not alone, that's not the reason. In addition, you're not just losing the staff salary, you are also then losing the productivity of that supervisor, because they are having to help train that new staff member. And then the last thing was just the retraining required for the new staff member. So if they have to get recertified, any additional trainings that just new staff have to take, then this will be additional costs that you just keep on repeating as you keep on bringing in new staff. And then one thing I want to quickly add is that these are the only three things that I looked at in the time frame I had. So for example, I did not look at the cost of the benefits for the staff member. So whatever numbers you see in the graph, those will be bumped up because it doesn't account for any benefits, which talking with HR, those are typically around 30% of the wages. So you could take the numbers from the next slide and almost multiply by 30%. And there's a more realistic number of the monies that are going out with really no return for BFHD. And the other thing was, I didn't take into account that the additional workloads we're putting on staff with the attrition, how does that then impact more attrition? If I'm overloading staff to try to get up at those inspections that are required for us, it's not something we just choose to do. It's something we're obligated to do via the state. What impact is that having on staff to try and keep up with that demand? And then obviously that's going to slow down the response time when we have, land inspections that need to go out for sewers or whatever, or food safety inspections. As we have more and more difficulty keeping those departments fully staffed and we keep on training, that's going to extend out those periods of, okay, we can't do an inspection in 4 weeks now it's 6, maybe now it's 8, because our staffing levels are so low and we can't have new staff doing inspections by themselves for that 6-month window. All right, so you go to the next slide.
There's a big version of this in your handout.
Yeah, because I'm pretty sure you won't be able to read. I have trouble reading that on the piece of paper right here.
My bulbs are hitting me now, right now, Janae. This is not nice. I know what you're trying to do right here. I just realized. Be prepared, okay?
So if you look at this graph, the optimum for this graph, if we have no turnover, is all those lines are 0. Because we've got no hidden costs, at least with the 3 things I said I was going to be talking about related to turnover. So the goal is 0. If you look at the graph, you can easily see in about the last 5 years, we've been going in one direction. I mean, before for the previous, maybe 10 years ago to 6 years ago, we were kind of bouncing up and down, not bad. But the last 5 years, it's been going in one direction, maybe since about 2019. Where it is. So over the past 10 years, the food safety department, with the data I was collected, they had a hidden cost of about $700,000. The land use department had a hidden cost of about $500,000 over that 10-year span. And like I said earlier, this does not include the extra benefits, costs associated with it, or again, does attrition feed on itself just because of the workload on staff? Any questions on anything?
Perfect.
Well, I've maybe got a suggestion, and what we're doing in Franklin County, and we are doing contract services. Maybe you need to look at the same thing, and that is you don't have them in-house, but there's people out there that do these services that you could hire. That way you take away the salaries and the benefits package, and it saves you a bunch of money. We have somebody right now working on our planning and building that is exactly that. And it is actually a better way to go.
I think City of Pasco is doing that too, because I'm doing a building in Pasco and it's not the City of Pasco doing the building inspection, it's a contract.
Yep.
Yeah.
Yep. That's what we're going to, and we are freezing all hirees right now in Franklin County because we are under the same situation. And everybody is, and Pasco is in the same boat.
You don't know what you're gonna ask yet.
We're still going.
I know.
Janine, I'm just looking at, so these particular positions that require on-site training, and having somebody shadow, the medical field is the same way. You have to have an intern and you have to have even behavioral health. And this was a huge problem in hiring new interns, is because you don't have the staff in behavioral health practices that even can cover the cost of that intern. They don't have the time. They need that revenue to keep their doors open. And so our program that we started when I was at the ACH helped pay for those interns. So the other thing that we looked at was, education, because it looks like that, is there opportunity? I'm just thinking out loud here, just out of the box. Is there opportunity for some of these positions to get that training elsewhere so that BFHD is not absorbing all of the cost to have somebody on board for 6 months. That's kind of a dead weight because they can't really do anything.
Yeah.
Are there programs in the state that even offer that kind of training? And is that a possibility? I don't even know. I mean, that would have to be maybe a legislative.
There are some supported by Department of Health where they will do, for example, in food safety, the Department of Health promotes like a new inspector training, but it's a 1 week course that goes over the basics. The training that we do here in-house is more specific to how, BFHD processes, how we do the inspections. But yeah, there is a lot of training, both in, Jody can probably speak to on-site, but Department of Health does lots of trainings for free for our environmental health staff. It takes about 6 months to get really comfortable with those codes and really comfortable with what you're looking at. And for us to be comfortable that you have that base level of competency to go out and be inspecting businesses.
And I'll add to that, Erin and I are both meeting with higher education systems around the
Okay.
state as we talk about developing improved certification
Yes.
courses so that they
Yes.
come out of school with more of the baseline knowledge that we would like them to have. And so part of that collaboration with higher ed is also happening.
And I would encourage you to go to CBC because that's what I did.
Yeah, we are.
Courses.
Yeah.
For mental health. I went there and I said, why don't you guys got a course here for it? And now they do have it and we're going to start having people available for our new facility.
Yeah, it's a challenge, I think, especially with a lot of public health programs, but environmental public health, if you come out of school with an environmental health degree, it's usually more focused on the environment. Not environmental public health is very different. Or we get people who come out like myself with a bachelor in biology or microbiology or some core science field. So a lot of people who come to us, we are starting from square one. So if we can continue our partnerships, I think, with academia, we can get people coming in with some more experience that will help. But yeah, it's a challenging position to train into, and then to say with the same degree and a little bit of experience that they can come here and get, they can then hop out to the Hanford area and make 60% more in salary. We end up being the training ground for them, and it's frustrating.
Is it typical for there to be a one-on-one relationship with the new person and the supervisor? Or does the supervisor sometimes have two or more?
We have quite a few staff in each of these programs. So there's a peer-to-peer relationship that you would develop where you can go most of the time, the new inspectors are out in the field with their peers. And then the supervisor will kind of do spot checks, have one-on-one meetings with them. So I think, Eric, you said that each supervisor estimated maybe between 10 and 25% of their time. And then the rest of it is peer shadowing.
Which talks about the extra burden on peers.
Except for the potential. Is there any potential for the trainees to work remotely and communicate, like with FaceTime or that sort of thing, so that, your full-time employee is doing all the other tasks that are possible at a desk while the newbies are out in the field? Is that a possibility?
I mean, I think it's different each program, but we typically don't want them to be out in the field by themselves until they have, until they're competent enough to be leading those inspections, liability wise.
And our board members will get lots of calls if they are not ready to do it.
Yes, we try to limit that as much as possible. It can't be a throw you into the water type profession. We're dealing with businesses and
When you train people, how long do they stay before they turn over usually? Do you have an average of is it a couple of years? Do you get 5 years? Is it
I didn't look at that, what the average stays for every school.
I haven't ran that data.
I don't
haven't
know
read
what the
that.
average is, but we'd be happy with 2 years. I'd be happy with 2 to 5 years.
Yeah, I mean, it's like, are you getting them to the 6 months and then they're ready to go?
Yeah.
I mean, what I can say from,
That's rough.
what I can say from the IT perspective, because we always onboard with people, it seems like from when I got here 7 years ago and today, the flow of these positions coming in for those departments, it's gone up dramatically.
So here's a graph of the land use program. It's fully staffed at 7 people, and then you can see the ups and downs of when they get fully staffed and then they have turnover.
It's over the past 2 years. It's later on in the packet.
So I'm gonna say, and this kind of dates myself, I think I'm getting you know, as we start to age, but like I notice our new hires, even at the CD, are not staying as long. There's a lot of just, you show up, you train, you jump, and I think there's some of that may also be, there's less of a staying with the company. It's how you make more money, you jump around, you keep changing.
Well, when I was looking at this, I found that Pew Research did a study and they said 65% leave a job or position because of pay.
Yeah.
And I think we're seeing at least that
Yeah.
percentage here, at least.
We've also had some other reasons for leaving too, and I've done a lot of winter research as well. We've implemented other programs within our agency to help bring people in and get them more acclimated to our facility and who their resources are and stuff like that. We've just rolled out a 30, 60, 90-day program for them that we're hoping will impact and have a positive impact on our new hires as well. So there's other ways that we're trying to get that retention to be brought up as well, outside of just wages, so.
And maybe a thought on that retention would be a bonus if they stayed a year.
So that's what I was gonna say, like, I think, like, we look into the contract thing, or it's something, okay, you're training me, okay, I'll sign a 3-year contract or a 4-year contract. Paying, you know, just to help keep it level instead of dropping back down and people leaving after the training and stuff. So I think doing something like that, but also contracting out or having them sign a 3 or 4-year contract or something.
There's pros and cons to that, though. I see that for senior management, but if we have to really look at that one, and sometimes that could be good too.
I know they got more to present, so we probably should.
Yeah.
I think the bonus would be the PERS is fully invested after 5 years, so that's the biggest perk.
Yeah.
The retirement plan.
So just note, it's really awkward to stand here when everyone's talking back. That's from my first experience. Throw that out there. Okay, so now Kyle's gonna get a little more in the current financial situation of those two departments, and then once he does that, Jody and Fuka will come up individually to talk about their departments and their current state. Thanks.
Alrighty. I'll be brief. I'm Kyle Phillips, and Lawrence, want to go to the next slide? So the two programs that we're focused on here is the land use program and the lab. And as you can see from the graph here, the land use program has been running at a net loss for the last 3 years. And the lab for the last 2 years. So the adjustments proposed are an attempt to bring the programs back to a break-even budget. Based on RCW 7046-120, which says that we cannot charge more fees than cover our costs. So we have to be break even. The land use program issues permits and does inspections to cover their costs. And the lab is a fee for service program that has seen the cost of its reagents and supplies increase dramatically over the last year. So I'm going to bring up Jody to talk about the land use program.
So you've seen this slide before that talks about our program's attrition. Since we had a major loss of our supervisor 2 years ago. When we had our supervisor of over 30 years leave. And at that time, a lot of knowledge walked out with him. And other than myself, who has been with this health department for over 28 years now. We never had anybody with that level of experience in our program. So out of the past 36 months, 28 of those months, we have not operated with a full staff. And of those 28 months, 5 positions have not been filled for 11 months. They were saying how 10% of supervisor time went to training new staff, and I can say that it went to way more than that. We have an environmental health specialist, one for each territory that we have. We have Benton-Franklin territories divided into 4 areas, and each territory has their own area. For quite a while this year, I had one fully trained EHS. And so that caused myself to come out of supervisor role to be an inspector and train 3 new people. And there was a lot of time that we spent there. And I know that I myself was inspector for 2 territories. The inspector that we did have was trying to do the other one, and then all of us were all trying to do that as well. So there was a lot with that. I've seen, with the time that I have spent here, I've seen over half of the people that have been in the land use, water, and on-site program. And usually once they get about 5 years experience, they're off. We do have a reputation, and a good one, for training new EHSs, environmental health specialists, and having those staff at Hanford. You know, they're more than just coworkers, they're our friends, they're our family now. And so we're still in touch with those former workers, and they're constantly letting us know about newer positions out in Hanford and trying to recruit from there. And then also, as Aaron started to mention too, the people that we get as applicants for new positions are just out of college and have little experience. And I know that when I first finished college, I didn't even realize that a health department existed. So it was a big learning curve for myself as well. So a lot of them, they just have no clue about public health. And if they do, it's with regards to WIC and immunization services, other avenues. So one of the ways, as you can see, our program has been in a hole for like 2 years. But we haven't raised fees in over 5 years, since 2020. And since that time, the cost of doing business has gone up tremendously. So the one fee comparison that I did was for a on-site septic permit. And typically what we do is we will do an application review, an office research for that application when it comes in. We go out to the site and look at the physical properties on that site, as well as any test holes to determine the soil type. We review the plot plan that is provided to us of what the homeowner wants to do on that property and verify that it matches with the soil and site conditions. We will write a permit, and then it sits for a while until they are ready to install it. But before it's installed, we have to do a final inspection. So we again go out to the site and we verify the work that the installer did and have them do corrections as needed. We go back to the office and we create a site plan, which when we're out there, we're taking measurements and making a 2-scale map of the system as it was installed at that time. We provide copies of that final approval to the homeowner as well as county agencies, and then we maintain those records of that system and the as-built, and and that's one product. That's the one fee we do, and we charge right now $700 for that fee. I looked at the the same permit in other counties, and they are charging roughly around $1,000, but some of them have even broken up into 2 fees. So it doesn't look quite so bad. Where, Spokane charges $770 just to do the site review, but to actually turn around and write the permit, there's another $870. So it's quite a bit more.
So that would be comparable to that $1,000 that you're proposing from both to the one. Okay.
Right. Chelan Douglas is probably the closest to us in that it's a 2-county department, and we have similar population bases in there. And they've split their fees apart too. So, they don't charge as much right now. They charge $790 for a permit. But if they have private water, if they have a single family well on that property, there's an additional $330 right there. And we include the water availability in our fee. So like I said, this is the most common application that we get and one that we deal with the most. And when you look at our fees, you know, they haven't been increased in 5 years. And a lot of times I looked at it and tried to figure out, like, we had just increased 5% every year. We would be where this is today, and it wouldn't seem quite as a shock when you see our fee going from 700 to 1,000 for this same thing. But
There's a formula for time value of money. I think that
yeah,
we're gonna have to hit it by doing this.
yeah,
We haven't kept up, so inflation, everything else, so yeah.
yeah, yeah.
Well, other departments are doing other things than increasing fees, and that is the electrical permit and inspection now is all done virtually. They film it. And if we was to remove ourselves from driving out there to look at the site, trusting that the landowner is digging the hole in the right spot and showing the depths and the soil, we could do that too and stop the increase, because this inflation isn't only hitting the health department, Franklin County, Benton, it's hitting every resident of these communities. The stores, gas station, you name it, everybody's paying more money for everything. They're paying more money for ground to build a house. They're paying the impact fees. They're going up every year to, if they don't have kids, they're still pay the impact fees for that house. You want a young family to have a house? We can't keep raising the rates on everything. They won't have a house. They won't be able to afford a house. That's my argument.
Okay, so my name is Bill and I'm the supervisor of the lab and here. So I'm here to propose the adjustment of the lab retreat fee. This graph say about the attrition of the staff, so it's not different from what Eric saw about for land use and food. This is allowed. And it's so that, in a long time, to finish or complete the work in the lab, we need at least 3%. But for a long time, we have only 2%. And last year, we was approved for a third person. But I took the position for 1 year, just since last year, and we start hiding the third person. And I tell a story how hiding is hard. Each of the time we run into hiding, I remember we have to post at least 2 times, each time 1 month. We offer, decline, offer, declines, until we get 1 person in. And that 1 person in stay only 3 months and help now. We have to do it again that round. It's difficult, so it's building a lot of cost for hiring and training. In the lab, in order to operate or doing the work in the lab is different from other one, like you're not just settle how to do things. You have to prove that you have to do precisely accuracy. And we have to number everything reported. So yes, when we have low staff, you can see this is the first month in a long time we have full staff, and this is November, and I want to keep this November for longer. So it has a higher cost for the hiring training, and when it's understaffed, it takes my time or other people time to stand up and do the work. In other department, it may like taking longer time, like you can delay, but we cannot delay. Sample come, we have to handle within certain amount of time. So it means I have to work overtime. So also the new staff will take longer time to complete the work. So that means the cost to do the work is higher. So this is also labor cost only. The next slide. Our lab, we just like building the house or cooking. We relies a lot about material, with chemicals supply. And you can see this is one of example how the chemical supply have been driven crazy for last 2 years, 2023 and 2024. This is an order from IDEC. It's one of the company that EPA or DOA number recommends, the standard method recommend we have to use the product from them. And we have to order every year. And I normally order about December so I can secure the price. 2023, my previous, the last previous supervisor ordered that amount of supply. It cost 25K, around 25. 24, I even had a little changing, minimizing. It's already suit to 42. And this year, I already squeezing a little more and it will double. So it's still keep going up. And this is just like one example. We have a lot of service to maintain the equipment and everything. The labor costs also going high. The next slide is talking about accreditation fee. So in order to operate the lab, we need to get the accreditation or kind of allowance. This is for operate by the Department of Ecology. So we have to pay not only the pay fee, but you have to kind of like do some study, pass some tests, submit document to them so they can review and give you the kind of accreditation to perform the test in the next year. Department of Ecology also have similar situation like us. For a long time, they didn't increase the fee and they suffer from understaff. So last year they proposed they're gonna increase the fee. And that is the proposal for until 2026. So each year you can see double cost and then another 50% added. So what cost is we have to pay, last year we paid like more than 3K. This year we pay more than 6K and that's gonna be keep increasing. And they formed the formula how to, the fee gonna just automatically rolling over the year. So there's an increase in the fee in order to open, keep the service going on. So we propose to increase the fee, but can you go to the next slide? So this is comparison of the current lab fee with some other lab. So this is, I just pick a couple of example of the tests that we have done. We done it in the lab. It's like 70, 60, 80% of the tests we do per year. We compare with some other health district labs. We have very few health districts in the state that still have a lab. Probably they closed down because of attrition or funding. But we are very low. We still maintain low. Even last year, we did a minor adjustment. We still low. But let's compare with a private lab. I picked two labs. One of Tennessee Northwest, which is in Richland and Tri-City here. The other lab is Anatech. We cover Broaden's area, Spokane, Tri-City, and Yakima. And you can see that we are also lower than them. It's the same test. But let's see about the private lab. It's just, that is a test. The hidden cost is like, they added like the service fee, like, expenditure service. And we don't have that. If we have a lab operate, we can do the test and provide the service at a fast rate without extra fee for the system. Like for example, like these days, we are trying to get the service we are helping the service for the city of colleges. They have the broken pipes and they need to test to see whether the water can be provided safely to the resident. And if they have to go to the private lab, you can see if they need the next day, it's gonna be 100% more, and 3 days gonna be 90% more. But in our case, we can give it up 18 hours without other extra fee. So, so we proposed for 2025 fee, but you can see with the 2025, we are not even we're still lower than what is private. So we are not trying to sucking the sky. We're just trying to making sure that we could keep our financial healthier status and maintain our service and probably keep the staff. If you have any, so that's one of the couple of the factor I propose I present to support for our proposal for fee is just next year.
No, I appreciate it. I'm gonna make some I just was writing a bunch of notes when you were talking.
You guys have any questions for Jody or Fook about any of the fees that were proposed in the packet?
I'll make my comments at the end.
If no comments or questions, BFHC then asks the board to review and approve the proposed fee schedule updates.
Go ahead.
So basically, I was taking I've been taking notes and stuff like that, and I know that from the presentations, we're probably one of the lower ones, and we're kind of outdated on that. I understand there's a cost of attrition. I understand if you have attrition and you have to keep on rehiring, training, there is definite cost on that. We've seen that on the county side. It's very expensive. We're just finishing up a wage compensation study that, you know, I asked for, and both Commissioner McKay and Commissioner Delvin agreed to agree. We haven't done one for 30 years. And so I know that during our budget time, I worked hard because we were just like all our neighboring counties. It's not a big secret. There's a lot of counties. I've talked to a lot of cities. Just got on a LSC, Legislative Steering Committee, meeting with 38 other county commissioners and stuff like that. And a lot of them are having difficulties on the financial basis. I came in on this 2 years ago. We worked hard on consolidating and reallocating funding and showing the different departments, hey, you can pull from this bucket of funding to put in this and retraining. So we are probably one of the few counties we worked very hard, and we're going to get ready to go on a budget where we're required to balance, but we actually broke even, which is very rare at this time. So attrition is an important part that costs money, and so we worked hard to do that. I know that hiring, let me just see here. Yeah, and there's a cost if we don't raise these fees, and I get it, Commissioner Didier. The bummer side is we haven't kept up a little bit. I get it because, you know, having been in the financial industry and the housing industry for 30 plus years, and costs are going up. But if we don't increase some of these fees to catch up, then we also are shooting ourselves per se, because we're not able to hire, we're not able to provide those services that are needed. And then if we have less people, there's you know, it would cause some of those delays for the public. And because of that, with some of those delays, it also can affect by unintentional consequences, other things that happen because of those delays. So I do think there's some value to that. I would be for it. I'm usually against raising fees. I know we have the opportunity to do levy tax, right? And I'm not a fan of that right now myself until the economy gets better. So we got to make sure that we're targeting the right things and we put the money invested in the right places, so that we're not just continually costing the public or taxpayers money, or in the health department or our counties more money. So I will probably support it. I hate raising fees, but in this one, if you don't do it, I think we're just going to continually cost us money in the long run, altogether.
So quick question for me on this. So say that I agree with you on the fee thing, especially since you haven't raised it for a while. Is it something though, like what you brought up too? If we can, okay, we raise the fee now, and then we find out that we can do a contract, we can, you know, contract out some of the services and stuff to where, okay, hey, our fees went up this high. Okay, now that we contracted out, we're saving money, we can drop our fees back down. You know what I'm saying? Like we try it out for a year or two. Is that something that we can look at a year or two down the road, or three?
I would offer first that would take a fair amount, ironically, of administrative dollars, because we have to work through our unions to do that, to be able to contract out. That would go on for a while, to outsource union health positions here. We would go through the process because the board's recommended that we look into that 100%, but that's gonna take some time.
Yeah.
To your point though, at the end, if our costs went down, of course, these would go down, absolutely. And we can't keep doing this 5 and 10 year yo-yo.
Yeah.
And honestly, these fees that we're proposing, they're not the highest. We're just trying to come up to the median. And two, Mr. Duder, this is something that's really important to me, that when you talk about our community and those that are affected, that are just trying to put food on the table, that's our staff too, that live in Franklin County and Benton County, that are trying to put food on the table and trying to hold down a good job. And so as an employer, as a community member and a leader of this agency, it's important to me that we take care of them too. And then finally, we're not putting in here exorbitant salary increases. This is just to keep, if you will, at a level of status quo. And then to account for what we do know the next 12 months. We're still in bargaining for these EHS positions. So we haven't even concluded, and we expect that could go on for some time into 2025. We're not shooting for the moon, we're shooting for the middle. To take care of our community and our team here.
No, and I appreciate it too, because like just looking at it, the comparisons to other counties, you know, we're not 100% higher. Like we're pretty much right there. Like Yakima is even higher than us and stuff. So that's what I'm saying. Like that's why I see this, and we're making it to where, okay, BFHD is still productive, but we're still looking at the community members too to say, hey, yeah, we do have to increase it, but we're still trying to make it to where everyone's still making it right. Yeah.
May I just ask a question? So what was the thinking about not having an extra fee for an expedited review of testing? Because everybody knows it costs a lot more to send stuff 2 days as opposed to, by regular mail. So I mean, what was the thinking behind that? That was really nice of you, but I would have expected you would have asked for more money for that initially, anyway.
It's gonna be dramatically increased because we do a lot of tests for the water systems and community here. No one want to wait for like 10 days, to know the results, like whether I can drink the water or not. And if we added the cost, it's, to me, it's just like, it's gonna just impact the system in some emergency as well,
And in some cases, we only use the expedited method. So we don't have a 7-day method and a 3-day method we use the 18-hour.
We only use the
single method.
24 hours.
I see,
So
okay.
we provide the expedited service already, which is why that is wrapped
Yeah,
already into
I
the
see,
cost.
got it.
So did those individuals out in Finley have to pay for their own wells to be tested, or was that paid for?
No,
by
we
the
were
company?
actually able to get a grant to help pay for that. Yeah, and we still have money in that and we're still paying for
And as
people to
far
get
as the
tested.
septics go, I mean, that area right there is if they're hiring a contractor to put that in and our health department is working with that contractor, there's no reason why they couldn't do a visual with an apparatus instead of having to drive all the way out there, all those hours and drive all the way back with the expense of the automobile and everything.
Yeah.
That's what the electrical industry is doing right now. Everything is not, they didn't do a walk through anymore.
Yeah.
So everything's visual.
I want us to be an innovative agency. There is a component for me though, that is like, we've got to crawl and walk and then run. And that is something that I would love for us to look at, 100%, Commissioner. But it's gonna take us a little bit to get there.
Yeah.
We've been through a lot, and to be at this point with this group of leaders doing this type of work didn't used to happen here. And we're just getting started.
And
But yeah, absolutely. we'll
with
get-
regard to contractors, I'm still training them. There's not very many. There are not very many people out there that know how to inspect or install a septic system.
In going to your point, I know you had kind of put this as attrition, and now I got my glasses, I can read, I was taking some. And I put the cost of attrition equals higher additional cost to operate, equals more work and strain on current staff members, which could mean more turnover. So once again, it's not just only having people leave, but it's also existing staff and the strain on them and potentially have them leave. So I think that's why we need to go ahead and do things like this to make sure that we're up to par on this. Because we don't want you to have to keep on continually doing this repeat, and people leaving out there as well.
So let's get we get a motion.
Quick side note, it looks like Commissioner Mullen dropped out at some point. So, but I did review the bylaws. We only need 3 of 4
Yep.
commissioners present.
Yeah.
Do the vote.
So we get a motion.
You want to do it? Come on, I got it.
You're the guy that's owned this so far.
Don't do that.
No, it's been recorded.
No, I'm not trying to tell that hard. I know, HR, finance stuff. So you have a motion on here, or you just want to go ahead and put?
I think it's just approval.
Yeah,
of
just
2025.
move to approve a 2025 fee schedule as presented. Would that work?
I'll second. Any discussion? All in favor, say aye. Aye.
Aye.
Nice. All right.
I'm gonna tell you right now, you're gonna get some heat on this one.
I know, but again, I know too, like I'm all for it and where it's something we can, okay, yeah, we went up here, we're figuring it out, we can drop a fee or something down the road. So that's why I'm saying.
I've
let's
never
try
seen
it
it
out.
tax be reduced.
I never have.
We could do something.
But I trust it.
Yeah.
Well, listen,
Yeah.
we can't leverage taxes anyway,
No,
so.
no,
I'm using that as I've never seen a fee go down.
Yeah. All right.
I know. You're gonna make this happen.
All right, we know we're running long today, everybody, so I'll make it quick. Announcement. So on Tuesday, Geez, October 29th. It's been a while already. We did have our FAB site visit and our staff met with the FAB reaccreditation board. We want to extend appreciation to board member Mosier for representing the entire Board of Health at the governing entity interview section. So thank you again, and hopefully you all appreciate her time representing you there. So where we are now with this process is we've done all we can do. Submitted all of our documentation, had our interviews and our process moving forward. We have to wait for the FAB site visit team to complete their final report regarding their overall review and recommendations. From the 29th, that's 4 to 6 weeks. So we're getting close, early December, for them to be at their outset. From there, it'll be sent off to the FAB accreditation committee or board who will make the overall determination to see if we will receive our accreditation. Of course, that board meets once a quarter, which means we will not likely hear anything. That meeting will occur in Q1 of 2025, and then we'll get our results back at that time. And so we will keep you posted absolutely of our status along the way. A sneak peek of some of the information from our exit conference that I wanted to provide for you is that the greatest strengths that the board or the interview committee, the site visit review team found in our agency were very strong staff that were professional, responsive, and open-minded, strong leadership, embracing change and growth in the organization, and strong community partnerships. Our opportunities for improvement were to condense and formalize our quality improvement documentation and expand the use of specific QI tools, fishbone diagrams, those kind of fun things that fall in that arena. Ensure regular updates to the Board of Health related to implementation of our strategic plan, and evaluate and plan infrastructure improvements around the significant growth of our community and our agency. So just wanted to, and that they appreciated listening to our staff and that they feel supported in prioritizing their work-life balance. So we'll give you more information later, but that's our update. So.
I love how you guys are going up and down and getting your steps in. I know. Good job. Good workout.
Hello again. So just a quick update on our accountability audit that just wrapped up last week. The audit looked at the district's compliance and adequate safeguarding of public resources from fraud, loss, and abuse. This includes the design, implementation, and maintenance of internal controls relevant to these objectives. In the opinion of the state auditors, the district's operation complied in all material respects with the applicable state laws, regulations, and its own policies, and provided adequate controls over the safeguarding of public resources. Our next audit will be in July.
Nice, good job. Yay.
All right, we'll be moving on to executive session for 2 hours. Is that it? We've been working.
Yeah, we'll have 3 all under the same time.
We'll get like a 5-minute break,
Yeah.
bathroom break, and then we'll, all right, they'll come back in.
Yep.
Okay. All right. How long?
People.
Yeah.
All right, so we're gonna be going into executive session for how long?
First one is for 5 minutes.
Okay. And
To include the entire board, Brandy, myself, and yeah, that's it.
If they're all under the same RCW, can't we just go in for one time period for all
I
of them?
thought we had to do them because they were different topics under the same RCW. Is Chris still with us?
He is.
It's just the RCW that you can go in under executive session. We're doing it in Franklin County. If it's the same
Yeah,
RCW, you can cover all
Well,
3 of them.
then 25 minutes.
okay, 25 minutes.
Do you want to get Aaron here? No, oh, shoot, because it is different. group.
Oh, yeah, okay.
Yeah,
Then you have to come in, you gotta break it out. It's different.
Yeah, that's
Yeah.
right.
so the first one's 5 minutes,
Okay.
to include the board, Brandy, and myself.
Like his classes. Sporting.
So we do
Oh,
have
Caesar.
Commissioner Mullen virtual, so
Okay.
he's gonna get you set up.
For sure.
Yeah, we're out of executive session, times 3:17. No decisions were made.
Second executive session for 10 minutes to include the entire board, Brandy, and our attorney, Chris Mertens. And Christopher Curley, our other attorney, couldn't be here.
For how long?
10 minutes.
10 minutes. Okay, we're out of executive session. No decisions made, discussion was given. What, we got another one now?
Yeah,
Okay.
same RCW, for 10 minutes to include the entire board, Aaron Hockaday, Amanda Moe, and Chris Mertens.
Yeah, this would be like 2 minutes.
All right, the time is 3:29. Out of executive session at the time, 38, 3:39, yeah, 3:39. Discussion was given, no decisions were made. And we move on to approval of vouchers.
Move that the Board of Health approves payment of voucher numbers 80-2024 through 89-2024 in the amount of $1,223,787.46.
Can I get a second?
I'll second.
Okay, we have a motion and a second. All in favor, say aye. Aye. Any opposed? All right, you guys have it. Okay. Well, everyone have a good Thanksgiving. Next board meeting is December 18th. Hope you guys have fun with family and friends, eating a bunch of turkey and potatoes and stuffing and
Turkey
gravy
sandwiches
and
with cranberry sauce.
cranberry sauce. Yeah. All right, this meeting's adjourned.